Hi, this is Dr. Karen Perez with a video on Candida Vaginitis. So this is actually an overgrowth of the Candida albicans yeast that is found in the vagina or the vulva. This is considered a normal vaginal flora, but can sometimes be pathogenic. So individuals who are diabetics, those with HIV, who are HIV positive, those who are on antibiotics such as amoxicillin, or have any immune suppression, are at high risk for having Candida vaginitis. In addition to those risk factors, adolescent female, middle-aged female, those who are pregnant, African American female, and sexual active male are also at risk. Now, what will the patient complain of when they come in? For the female, you will find symptoms as burning, itching, and irritation in the vagina and the vulva, or even both areas. For the male, this is called planitis, and they will complain of reddish rash and itching on the glands of the penis, burning during intercourse, but they will not have burning on urination. Now, the vagina, they will have discharge that is reported as being white color, and even on examination, you will see it. It will be even described as cottage cheese or thick texture. So, where would you find this cottage cheese thick texture? It will be in the vaginal canal, even pasted on the wall of the vagina. In the posterior fornix of the vagina will be full of thick white discharge. It will also be red, and irritation will be noted. For the male, you will see red and eroded patches, tender to touch, small white round lesions with red base on the gland of the penis. Now, what tests would they order, or you as a practitioner will order? A cotton swab with vaginal discharge in the middle of the glass slide. This is called a wet smear microscopy test. And what they will do is they will add a few drops of normal saline to the discharge. They will cover it with a cover slip and examine it under a microscope. They set it to a high power. What they will find is what they call a pseudohyphae and spores with large number of white blood cells will be present. All right, and here is what it looks like. Pseudohyphae. This is the hyphae, this is a yeast, this is a pseudohyphae that will be noticed on the wet smear microscopic test. And as I said, they swipe a cotton swab with the vaginal discharge on one of those glass and examine it underneath a microscope. Now, what is the treatment? Now, they will treat with monostat, or they will give clotrimazole for 7 days over the counter. Now, for prescription, they may get diflucan, which is 100 milligram tablets times 1 dose, or they will get Tarazol 3. This is a vaginal cream or suppository. If patient is on antibiotics such as amoxicillin, which is one of the risk factors for yeast, it is recommended that they have daily yogurt or some kind of lactobacillus pills. All right, because remember that antibiotics such as amoxicillin is one of the risk factors for having Candida. Now, thank you so much for watching this video. The information from this video comes from Mary Leak, which is her book, Adult Gerontology Nurse Practitioner Certification. It also comes from a Fitzgerald book, which is another nurse practitioner book. In addition to that, a textbook called Primary Care, the Art and Science of Advanced Practice, written by Duffy and others. Thank you so much for watching. Please make your comments below.